Colloidal silver has become one of the most controversial natural remedies in both human and pet health. Some claim it can treat infections, boost immunity, and even replace antibiotics. Others warn it's ineffective or worse, harmful. So today I'm breaking it down scientifically and legally, what it is, how it works, what the evidence says, and whether it's actually safe for dogs and cats. What is colloidal silver? Colloidal silver is a suspension of tiny silver particles in liquid, usually purified water. These particles are microscopic often, measured in nanometers, and remain dispersed rather than dissolved. It is typically produced using a process called electrolysis, where an electric current passes through silver electrodes in water, releasing silver ions and particles. Historically, silver has been used for its antimicrobial properties, long before modern antibiotics existed. However, its use declined significantly after antibiotics became widely available due to stronger evidence and better safety profiles. What is it made of? Colloidal silver products generally contain silver nanoparticles or ions, distilled or purified water. The concentration is often measured in ppm, parts per million, but this does not guarantee safety or effectiveness. Importantly, product quality varies widely. Some may contain inconsistent particle sizes, contaminants, or higher than labeled concentrations. Who made or discovered it? Colloidal silver is not a modern invention. Its antimicrobial properties were recognized in ancient civilizations, including Greek and Roman societies, which stored liquids in silver containers to prevent spoilage. Modern colloidal silver products are commercially manufactured by supplement companies, not pharmaceutical regulators, meaning they are not standardized like approved medications. How does it work? In laboratory settings, silver ions can disrupt bacterial cell membranes, interfere with enzyme function, damage microbial DNA. This gives silver antimicrobial activity in vitro and controlled lab conditions. However, and this is critical, effects seen in Petri dishes do not always translate to safe or effective treatment inside a living animal. What is it used for in pets? Common claimed uses include skin infections, wound care, eye infections, ear infections, immune support. However, these uses are largely anecdotal and not supported by strong veterinary clinical trials. Some veterinarians may use silver-based compounds in specific medical-grade applications like wound dressings, but this is very different from oral or general colloidal silver supplements. Is it safe for dogs and cats? Short answer: it is not considered safe or recommended for routine use. There is no strong clinical evidence supporting its safety or effectiveness when ingested by dogs or cats. Cats, in particular, are highly sensitive to toxins due to their unique liver metabolism, making unregulated substances more risky. Benefits. What does science say? Potential benefits: antimicrobial activity in lab conditions, limited topical use in controlled medical settings, but there is no high-quality evidence proving it safely treats infections. In pets, when used orally or systemically, risks and dangers. Known risks include silver accumulation in tissues, toxicity over time, organ stress, especially liver and kidneys, disruption of normal gut bacteria. One of the most well-known conditions is Argyria abae, permanent bluish-gray discoloration caused by silver buildup. While more documented in humans, it highlights the body's inability to eliminate excess silver. Side effects. Reported side effects may include vomiting, lethargy, loss of appetite, neurological symptoms in severe toxicity, organ dysfunction with long-term exposure. Because products vary, predicting dose-related effects is difficult. Have there been deaths? Documented fatalities in pets are rare in scientific literature, but that does not mean it is safe. The lack of regulation, inconsistent dosing, and limited studies mean risks may be underreported. Toxicity cases and adverse effects have been observed, especially with prolonged or high-dose exposure. Which pets should not use it? Avoid in cats, higher sensitivity, young animals, pregnant or nursing pets, pets with liver or kidney disease. In reality, most veterinary professionals advise avoiding it entirely unless under strict clinical guidance. How long can it be used? There is no established safe duration. Because silver accumulates in the body, long-term use increases risk. Even short-term use lacks reliable safety data. What should pet owners look for? Warning signs of potential issues. Behavioral changes, digestive upset, skin or gum discoloration, reduced appetite, weakness or lethargy. If any symptoms appear, discontinue use and consult a veterinarian immediately. Legal and regulatory status. Health authorities, such as the FDA and WHO, do not approve colloidal silver for treating diseases in humans or animals. It is typically sold as a supplement, meaning it is not required to prove effectiveness. It is not regulated like a medication. This is a major safety concern. Colloidal silver has real antimicrobial properties in controlled environments, but that does not make it a safe or effective treatment for pets. The risks, lack of regulation, and absence of strong clinical evidence mean it should not replace veterinary care. If your dog or cat is sick, the safest and most effective option is always evidence-based veterinary treatment.